Hello and a warm welcome. This is Dr. Shreya and I have immense pleasure to welcome you all once again to this live session on arthritis, management and its prevention. Be joint smart. So we all want you to be smart and have healthy joints. So in a few minutes we are going to go live with one of the leading rheumatologists of Bangalore, Dr. Yogesh, who's going to help us understand the myths and facts about arthritis. So each one of us have faced chronic pain once in our life. What do? We do not understand this simple fact that it's our immunity and immune response which reacts against us. Rheumatologists are those specialists who help prevent joint damage and help us prevent arthritis, which is an immunity disorder. So let's learn from Dr. Yogesh. We'll be live for 1 hour. You can post your questions on Facebook, YouTube, Twitter, or on the app at drcl.in/joint. Remember to use #BeJointSmart. Over to Dr. Yogesh now.
Hi, good evening everybody. I am Dr. Yogesh Singh, consultant rheumatologist at Manipal Hospital, Bangalore. Welcome to this Healthcast. Today we'll be discussing about arthritis. What are the symptoms of arthritis, treatment of arthritis, diagnosis of arthritis. And as we go in this discussion, we'll realize that arthritis, contrary to popular belief, is not a disease of old age. Majority of the patients who have arthritis are in the younger age group. Before going to the actual discussion, one of the most common questions that people have in mind or they ask us is, what is this rheumatology? Who is a rheumatologist? So rheumatologist is a specialist physician who takes care of diseases which involve the bones, joints and the muscles. And as rheumatologists, we see mainly arthritis. We also see other complicated diseases, what we call as autoimmune diseases, which are because of increased functioning or hyperfunctioning of the immune system. What is arthritis? Arthritis means inflammation of the joints, but of late it has these days is referred to as arthritis. What are the different types of arthritis? There are more than 150 types of arthritis. Broadly, arthritis is divided into 3 types: inflammatory arthritis, degenerative arthritis and crystal arthritis. In inflammatory arthritis, there is basically inflammation in the joints. Rheumatoid arthritis, seronegative spondyloarthritis are some of the examples. In degenerative arthritis, there is wear and tear of the joints. Osteoarthritis is an example for degenerative arthritis. In crystal arthritis, there is deposition of crystals in the joints which cause inflammation. Gout and pseudo-gout are some of the examples. How common is arthritis? Arthritis is very common in the population. Conditions like rheumatoid arthritis, seronegative spondyloarthritis are supposed to affect 1% of the population. That means 1 in 100 of the population can be affected by either of these 2 conditions. So India's population is about 1 billion. You can imagine how common these conditions are in India. So they are pretty common. Conditions like osteoarthritis, which are due to wear and tear of the joints, they become more common with age. By the age of 75, more than 1/3 of the population will be affected by these conditions. So these conditions are very common. What causes arthritis? It's very difficult to say. There is no single cause which is responsible for arthritis. It's because of a combination of events, genetic predisposition and environmental factors are important, but not everybody with the particular gene in the particular environment will have arthritis. So there is need for a trigger which will trigger arthritis in a genetically predisposed individual in a particular environment. What are the symptoms of arthritis? There are 3 main symptoms of arthritis: joint pain, joint stiffness and joint swelling. This is the normal structure of a normal joint. Nature has created this very beautifully, wherein each structure has its own function. So in a joint we have bone, which is important for movement. So if the bones keep moving against each other, they will cause damage or wear and tear. So there is a cartilage, a cushion-like structure which is present between two bones, so which will cushion this impact whenever the joint is moved. So there is synovial fluid or a lubricant which lubricates the joint and helps in its movement. So this synovial fluid is produced by cells which line the bone. This is called synovium, and all these are enclosed in a structure called the joint capsule. So in osteoarthritis, this is not moving. Yeah, in osteoarthritis, the structure that is affected is the cartilage, because with age this cartilage gets worn and torn, and because of which it becomes thinned out, and this causes the reduction in the joint space, because of which the bones start rubbing against each other. This results in pain and difficulty in movement of the joints. In rheumatoid arthritis, the main problem is in the synovium. Synovium is the lining of cells which are present over the bones. These produce the synovial fluid which is for lubrication of the joints. In rheumatoid arthritis, the synovium becomes very active, produces a lot of this synovial fluid, which results in distension or swelling of the joints. This synovial fluid contains what we call as inflammatory mediators, which over a period of time causes damage of this cartilage, again resulting in reduced joint space and the symptoms what we see with rheumatoid arthritis. How is arthritis diagnosed? There is no single test for arthritis diagnosis. Few conditions like diabetes or thyroid problems or hypertension, they have specific values. Suppose the sugar is above a certain level, then you can say this individual has diabetes. If the blood pressure is above a certain level, then you can say this individual has blood pressure problems. But in rheumatology, there is no single, or in arthritis, there is no single diagnostic test. Diagnosis is based on a combination of factors: medical history, physical examination, tests which may include blood test, X-rays and urine tests. What are the treatments for arthritis? We have to understand that there is no single common treatment for arthritis. The treatment depends on the type of arthritis. Even in a single type of arthritis, the treatment needs to be individualized. In general, there are three main forms of treatment: non-pharmacological measures or measures apart from medications, drugs or medications, and surgery. Non-pharmacological measures may include exercises, lifestyle changes, joint protection measures, weight reduction. So these are important in conditions like osteoarthritis, whereas pharmacological measures or medications are important in conditions like rheumatoid arthritis, wherein we give medications which control the disease process, suppress it, thereby reducing the symptoms of the disease. In some conditions, surgery may be required, especially in osteoarthritis, and in other types of arthritis if the disease has been there for a long time and has resulted in joint damage. Rheumatoid arthritis is a very common type of arthritis. One of the most common questions that people have in their mind when they come to the clinics is, my arthritis is there only for a few weeks or few months. Do I really need to get it treated? Or people will say, doctor, I have having this arthritis for 10 years. Why should I bother about it? Why should I get it treated? It's very important that we treat these conditions, because arthritis is not just a disease of the joints, it has effects on a lot of other organ systems also. It may affect the joints over a period of time. If arthritis is not well treated, it causes joint damage, joint deformities, and over a period of time these things progress, and joint deformities cannot be reversed with treatment. Most of them require surgical measures. Arthritis can have effect on other organ systems also. It is similar to diabetes or blood pressure in this respect, wherein apart from they may have effect on other organ systems also. In rheumatoid arthritis, or patients with rheumatoid arthritis have higher risk of cholesterol, they have higher risk of blood pressure problems, they have higher risk of diabetes problems, they have higher risk of stroke, they have higher risk of heart problems, heart attacks. In addition, it also affects how they interact with other people, may affect interpersonal relationships, may affect their functioning in the society, it may affect how they function or how they work at their workplace. So, it may affect in disability, it may affect the quality of life. So, arthritis is not just a joint problem, it has effects on other spheres of an individual's life. This joint inflammation over a period of time causes damage or complications which are irreversible. So, it is never too early or never too late to treat arthritis. Back pain is a very common problem in the general population. Most of us have back pain at least once in our life, but in a minority of patients, less than 5% of them, this back pain can signify a type of arthritis called seronegative spondyloarthritis. It is very important that this condition is recognized because the treatment and outcome is entirely different. If untreated, this will again lead to joint deformities which become irreversible with treatment. This is just a quick symptom checker to see whether an individual with back pain has inflammatory back pain or back pain due to arthritis. It basically has 5 questions. If 4 out of 5 are present, then individual may have back pain due to arthritis. One is age. If the back pain starts before the age of 40, if it starts gradually in contrast to starting suddenly, and if it improves with exercise, if it works with rest, and if it is worse at night and worse in the morning with lot of stiffness in the back. If 4 out of these 5 things are present, then individual may have inflammatory back pain or back pain due to arthritis. Thank you all for your attention. I think we can go to the question and answer session. This question is by Parag and it's about exercises in arthritis. are the recommended. Gone are the days when joint rest used to be advised for people with arthritis. These days this is no longer advised. So exercises are definitely important for individuals with arthritis. Exercises have multiple benefits in people with arthritis. They improve the general health, improve the energy levels, they improve the joint movement, they also strengthen the structures around the joint. So what type of exercises can be done? Exercises which improve or increase, moderate exercises as what we call are advised. Moderate exercises are one which slightly improve the heart rate. So exercises like activities like walking, swimming, cycling, these activities can be done at least 5 times a week. This question is about from Anwar. It is about managing pain in patients with chronic arthritis, especially in the hand joints. So the treatment again depends on the type of arthritis, what is the cause for arthritis, or what is type of arthritis which is causing the joint pains. In general, the pain is managed with medications which will reduce the pain. And as I said, depending on the joint type of arthritis, there may be requirement for exercises to strengthen those muscles, improve the range of movement. So these are the modalities which will help to improve the pain in the joints. I think I've answered the questions. Can we move over to the next question, please? The next question is by Abhinav. It's about whether children can have arthritis. In contrast to the popular belief or myth, people believe that arthritis is just a disease of the old age. People with younger age can also have arthritis. Children can also have arthritis. In children, the most common type of arthritis is called juvenile arthritis. So yes, children can have arthritis. Can we go to the next question, please? The next question is by Ajay. It's about when is surgery indicated in individuals with rheumatoid arthritis. In individuals with rheumatoid arthritis, surgery is generally indicated in a very specific subset of patients or individuals wherein the joint or the disease has been for a long time and which has resulted in joint damage which we are not able to reverse with treatment. So generally it is rheumatoid arthritis affecting the knee or the hip joints, wherein if the damage is beyond a certain level, in them surgery may be required to take care of the problem, usually in the form of joint replacement surgeries. I think I have answered this question. Can we go to the next question, please? The next question is by Mahtab. It is about treatments for rheumatoid arthritis and psoriatic arthritis. Rheumatoid arthritis and psoriatic arthritis or inflammatory arthritis, the treatment mainly is medical treatment, and it is in the form of what we call as disease modifying agents which modify or control the disease, which results in disease control, reduced pain, reduced joint swelling. The common disease modifying agents or drugs what we use include Methotrexate, Sulfasalazine, leflunomide. So these medications can be used alone or in combination. Again, the treatment needs to be individualized according to each patient. I think I have answered this question. Can we go to the next question, please? The next question is by Malishka. It is about, are there any tests to diagnose or detect arthritis? In contrast to a lot of diseases what we see, diabetes, blood pressure, where certain level or certain value gives us the diagnosis. Blood pressure over a certain value gives diagnosis of blood pressure problem, or sugar levels over a certain level make the diagnosis of diabetes. There are no such tests for detection or diagnosis of arthritis. The diagnosis of arthritis is based on a combination of medical history, physical examination and blood test or investigations. Investigations or blood test lend to the diagnosis. They don't make the diagnosis themselves. I hope I have answered the question. Can we move to the next question, please? Next question is, can arthritis be prevented? Well, it's a difficult question, but taking the following steps may help us to prevent arthritis. One is maintaining a healthy lifestyle, eating healthy food, trying to maintain an ideal body weight, being physically active, that is doing regular physical exercises, and avoiding smoking. So if you follow these steps, one has a good chance of being able to avoid certain types of arthritis. I hope I have answered the question. Can we move to the next question, please? The next question is by Salil. It's about why are women more prone to certain bone and joint conditions. This may be partly true because some types of arthritis and autoimmune diseases like SLE, Sjogren's syndrome are much more common in females when compared to males. The probable reason may be due to the female hormones and the X chromosome which females have. These two promote what we call as a pro-inflammatory environment, wherein the immune system is always active, alert. This is possibly an evolutionary change to protect the women because their levels of stress are probably much more than what a male experiences. So in some people this may become counteractive, leading to a very active immune system which may attack its own body, resulting in autoimmune diseases and conditions like rheumatoid arthritis, Sjogren's and SLE. I hope I've answered the question. Can we go to the next question, please? The next question is by Chetan. It's about whether males also have increased risk of osteoarthritis. Osteoarthritis as such does not show any sex discrimination. That means that it is not more common in men or more common in women. Things that increase the risk of arthritis is activities which may worsen or increase the risk of wear and tear in the joints. These include injury, which may be sports injuries or other injuries to the joints, especially the knee. Weight of an individual, if the weight is more, the stress on the joints is on the weight bearing joints like the knee is more. And other things which may increase the risk is if there are activities which put stress in the joint, like people who do activities where there may be requirement for squatting and getting up, like manual laborers. So sex as such has no discrimination or risk of osteoarthritis especially. I hope I've answered the question. Can we move to the next question, please? The next question is by Ajay about the side effects of methotrexate in rheumatoid arthritis. Methotrexate is what we call as the anchor drug in treatment of rheumatoid arthritis. It is one of the most preferred drugs. It's a very safe medication. The side effects can be of two types. One is mild side effects. The second is severe side effects. In general, the risk of side effects is very minimal. The mild side effects may include vomiting feeling, vomiting sensation, tummy pain. Some people may experience hair fall. The serious side effects include abnormalities of the liver tests and effects on the blood counts, bone marrow. To minimize these effects, what is done is before starting methotrexate, we do a blood count, complete blood count, which looks at the hemoglobin, blood total counts, platelets. We do a kidney function test to look at the creatinine, and we do a liver function test. We start methotrexate only in people whom all these tests are normal, and while on treatment also we periodically check these tests to minimize the risk of side effects. I hope I have answered the question. Can we go to the next question, please? The next question is by Aksham. It is whether rheumatoid arthritis shorten the lifespan of an individual. Yes, rheumatoid arthritis can shorten the lifespan of an individual suffering from that condition. It has been shown in research that the average lifespan of an individual with rheumatoid arthritis is 5 to 10 years less than an individual without rheumatoid arthritis. The possible reasons could be that people with rheumatoid arthritis have an increased risk of blood pressure, increased risk of high cholesterol, increased risk of diabetes, increased risk of stroke, increased risk of heart problems. So, the way to minimize these adverse effects or effects of rheumatoid arthritis on other organ systems is early diagnosis and appropriate treatment. So, by doing early diagnosis and appropriate treatment, we can control the inflammation due to arthritis, due to rheumatoid arthritis, and hopefully this should result in a normal lifespan of an individual with rheumatoid arthritis. I hope I have answered the question. Can we go to the next question, please? The next question is by Premant. It is what is remission in arthritis? This term remission is mainly used in arthritic conditions, mainly rheumatoid arthritis and seronegative spondyloarthritis. Remission means total or good disease control. If an individual with rheumatoid arthritis has good disease control, by that I mean no joints which are painful, no joints which are swollen, and the inflammatory markers as what we call ESR and CRP within normal limits. So, this is what the definition of remission is. Remission or low disease activity state is one of the targets of treatment what we use when we treat individuals with rheumatoid arthritis. So, with treatment we aim to control the disease as much as possible and to achieve remission. And with current treatment modalities, remission is possible in individuals with rheumatoid arthritis. I hope I have answered the question. Can we go to the next question, please? next question is by Vishu. It's about whether yoga helps in alleviating arthritis pain. So there may be a lot of ways of looking at this. One is people who have this back pain. So in them, yoga postures may be very beneficial, because the most common cause or factor which is causing back pain is basically poor posture, lack of muscle strength in the back muscles. So these are the factors which can cause back pain. So yes, maintaining a good posture, doing regular yoga will definitely help to alleviate the pain because of these conditions. In addition, yoga may be beneficial in people with other types of arthritis also, because if you look at people who are doing yoga versus people not doing yoga, who are on treatment for arthritic conditions, people doing with yoga sometimes do much better than people not doing yoga. So probably while doing yoga, there are a lot of what we call as natural painkillers, natural anti-inflammatory which are secreted in the body, called endorphins. So these may help to control the disease better. So yes, I think yoga will be beneficial for individuals with arthritis. It is part of the treatment along with the medications, not as a standalone treatment. I hope I've answered the questions. Can we go to the next question, please? The next question is by Martina. It is arthritis infectious? So there are subset of arthritis what we call as infectious arthritis, which is caused or which is due to infection in the joint. So these are called infectious arthritis. So this could be because of bacteria like staphylococci, streptococci, or other bacteria like tuberculosis. Other types of arthritis like rheumatoid or spondyloarthritis or osteoarthritis are not infectious. The other way to look at it, or other meaning of this question, could be infectious means does arthritis spread from one person to the other. So if you look at it from that point of view, no, arthritis cannot spread from one person to other person. So that way it is not infectious. So I hope I've answered the question correctly. So can we go to the next question, please? The next question is by Usha. It is about managing post chikungunya infection joint pains in an individual with rheumatoid arthritis. The treatment will basically require two things. One is controlling the pain or inflammation in the short term, and the second aspect of the treatment is for controlling the disease process in the long term. For short term, medications which may be helpful include pain medication, and depending on the joint which is affected, suppose it's a large joint like knee or the shoulder or the ankle, these joints can be given a local injection into the joint itself, which will reduce the inflammation. These injections are usually steroid injections which are quite safe, can be used safely. In the long term, there needs to be adjustment of the arthritis medication whatever an individual is on. Suppose somebody is on Methotrexate 15 milligram. For long term control of the disease, there may be need to increase the dose of medication or increase the dose of Methotrexate to say 20 milligram per week. So in short term, the pain control is with pain medications, and in long term it is by controlling or adjusting the arthritis medicine dose. I hope I've answered the question. Can we go to the next question, please? So next question is by Manjunath. It is whether arthritis can be cured completely or can be just managed. Well, again, it depends on the type of arthritis what an individual has. Infectious arthritis, which are due to infection in the joint itself, can be cured completely. So you take appropriate antibiotics, the infection clears off completely, the arthritis also goes off. Whereas for other types of arthritis like rheumatoid arthritis and spondyloarthritis, these conditions require long-term treatment. But what we have to understand is that no cure does not equate to no treatment. The treatments that are available currently are very effective, very safe, and with appropriate treatment, an individual will lead a normal life. So if an individual with rheumatoid arthritis who's taking good treatment, proper treatment, you won't be able to differentiate that individual from another individual when you see them outside, say in the mall or railway station. So we can manage these conditions excellently. Though we cannot cure these conditions, but we can treat them very well so that an individual can lead a normal life, can function normally in the society and do whatever he or she wants to do in life. I think I've answered the question. Can we go to the next question, please? The next question is by Lohit. The question is, can hepatitis C lead to a flare-up of arthritis? Hepatitis C is infection by hepatitis C virus. So it usually presents with liver problems, but hepatitis C infection can have what we call as extrahepatic manifestations. That means that it can also have effects on organ systems apart from the liver. So arthritis is one such extrahepatic manifestation. So yes, hepatitis C can cause arthritis, but it is a very rare manifestation. So generally, if an individual comes with arthritis, we do not think of hepatitis C as the first possibility. So yes, it can cause arthritis, but it is very rare, very uncommon. I hope I've answered the question. Can we go to the next question, please? The next question is by Vishal. It is about diet according to blood type. Does it reduce the inflammation in arthritis? Diet and arthritis is a very common question that most of the people who have arthritis who ask us when we are in the clinics. Unfortunately, diet doesn't seem to have much role in causing arthritis or reducing the inflammation in arthritis. There's common folklore, to avoid lentils, avoid brinjals, so on and so forth. But from an evidence point of view, there is nothing much to suggest that diet has any role in reducing the inflammation in arthritis. There are some small studies which suggest that Mediterranean diet may be helpful in reducing inflammation in arthritis, but these are very small studies. So in general, what we advise to people is please follow a healthy diet, which is very important. So I hope I have asked the question. Can we go to the next question, please? The next question is by Neeta. It's whether sulfasalazine is a right treatment for palindromic arthritis. There is an entity called palindromic rheumatism, wherein individuals get episodic joint pain, joint swelling and restriction. These come in episodes, so which may vary from person to person. So they get joint pains for a few days and then they get better in between for a time period which may range from weeks to months. They again get another attack. Again they are all right for a few weeks to months. So this is what is called as palindromic rheumatism. There are a lot of disease entities which can cause palindromic rheumatism. Could be rheumatoid arthritis, could be spondyloarthritis, IBD associated arthritis, sarcoid arthritis. So there are a lot of conditions, but the most common cause for palindromic rheumatism is rheumatoid arthritis. So in rheumatoid arthritis, this palindromic rheumatism is a very mild form of arthritis. Generally what we do is start an individual on hydroxychloroquine. Hydroxychloroquine takes about 3 to 6 months to have full effect. If at the end of 6 months, if an individual is taking hydroxychloroquine regularly but continues to have joint pains or attacks, so in such individuals we do add additional medications which may include sulfasalazine, methotrexate or leflunomide. So if in this particular case a trial of hydroxychloroquine has been tried for at least 6 months, and despite that if the joint pains are still persisting or person has having still attacks, so in them yes, sulfasalazine can be used. I hope I have answered the question. Can we go to the next question, please? Next question is by Astha. It is about whether heating pads are good to manage pains in individual with arthritis. In general joint pains, two types of therapies which involve heat or cold has been advised. One is using cold, the other is using heat in the form of heat pads or hot packs. So in general, these cold packs are advised for individuals with sports injuries, and these hot packs are advised for individuals who have arthritis due to inflammatory conditions. So yes, heat pads can be used. They do produce short-term relief in some individuals, so they can be used as part of the whole treatment, not as alone or standalone single treatment. One thing to keep in mind when we use these hot pads is to make sure that they are not too hot, because if they are too hot they can cause burns on the skin where the hot pads are kept. So yes, heat pads can be used in arthritis. They provide short term relief, they are part of the treatment, but be careful, do not burn yourself. I hope I have answered the question. Can we move to the next question, please? The next question is by Moisina. It's about what should one do after being newly diagnosed with arthritis. The treatment of arthritis depends on type of arthritis. There is no single magic cure for all types of arthritis. So it needs to be individualized based on the type of arthritis. For example, in somebody who's got rheumatoid arthritis, as soon as the diagnosis is made, your physician or rheumatologist or doctor would have prescribed you medications which will control your inflammation. The medications will be in two forms. One is for immediate control of pain, which will usually include painkillers. The other thing is for long term control of the disease, what we call as disease modifying agents or DMRDs, which control the disease process and thereby reduce the inflammation and joint pains, joint swelling. So these disease modifying agents usually include Methotrexate, Sulfasalazine, leflunomide, can be used in alone or in combination. Whereas in individual with the conditions like osteoarthritis, which is due to wear and tear, herein the non-pharmacological measures or measures apart from medications are important, which may include reduction of weight, avoid joint stress or joint protection, which may include avoiding activities where you have to squat and get up, joint exercises to strengthen the muscles around the joints, and medications may be in the form of mainly symptom control to reduce the pain. So the treatment of arthritis depends on the type of arthritis, but there should not be any delay in initiating treatment. So treatment should be started as early as possible, as soon as the diagnosis is made. I hope I have answered the question. Can we move to the next question, please? The next question is by Hamid. It is, what should one expect when coming off methotrexate and hydroxychloroquine? When I presume the person, whoever is getting this treatment, is for rheumatoid arthritis. Generally, rheumatoid arthritis requires a long-term continuous treatment. We do attempt to reduce and stop the medications in some individuals who have achieved what we call as remission status. That means that they have very good disease control. There are no joints which are painful, no joints that are swollen, and their inflammatory markers, that is ESR and CRP, they have been normal for at least 2 years. If somebody has achieved this condition or status for at least 2 years, in them we gradually reduce the medications and try to stop them. But unfortunately, we are able to maintain this remission or disease control state only in 25% of individuals after stopping the medicine. So 75% of them, the disease tends to come back. Usually it tends to come back from 6 months to 6 months to 12 months after stopping the medications. So in this case, you have to probably watch and see if your pains are coming back then you need to go back to your doctor so that the medications can be restarted. I hope I have answered the question. Can we move to the next question, please? The next question is by Aditya. Is hand deformity inevitable in individuals with rheumatoid arthritis? The answer is no. Deformities are a reflection of damage in the joints, which happens only if the diagnosis has been late or if the treatment has been inappropriate. If an individual with rheumatoid arthritis is diagnosed early, treated appropriately with medications, then we can control the damage, we can control the inflammation and prevent damage from happening. So if treated properly, these hand deformities should not happen. So is hand deformity inevitable in patients with rheumatoid? The answer is no, they are not inevitable. I hope I have answered the question. Can we go to the next question, please? The next question is by Mahesh. It's about treatment of rheumatoid arthritis. So are there any treatment modalities apart from medications which can be used? Yes, there are, but in rheumatoid arthritis, medications form the mainstay of the treatment, and whatever medications we use are quite safe, quite effective, and we hardly come across any side effects or adverse effects because of them. Along with medications, one can try to use other measures which may help to control the disease better, may help to control the pain better, may help to manage the arthritis better. So apart from medications, the other measures include appropriate health lifestyle, taking a healthy diet, being physically active, doing regular exercise. So these other measures apart from medications are part of the treatment of rheumatoid. So these measures cannot replace medications as a treatment as rheumatoid. So along with medications, these other measures can be done, which may improve the outcome of rheumatoid arthritis. I hope I have answered the question. Can we move to the next question, please? The next question is by Sivant. It is what is the difference between rheumatoid arthritis and osteoarthritis? There is a lot of difference between these two conditions. Rheumatoid arthritis is because of inflammation in the joints, and it tends to affect younger individuals when compared to older individuals, and the type of joints or the joints it affects is different. It usually affects joints like the shoulder, the elbow, the wrist, the hands, knee, ankle. It is what we call as polyarticular presentation. That means it involves a lot of joints at a time, and the treatment is basically based on medications. Whereas osteoarthritis is because of wear and tear of the joints, wear and tear of the structures that form the joints, and it tends to occur in older individuals. As we start getting older, most of us will have some wear and tear in the joints, some osteoarthritis in the joints. The joints it affects is little different. It commonly affects the knee joints, it may affect the hip joints, it usually affects the first MTP or the great toe joints in the foot, and in the hand it mainly affects what we call as the thumb joints and the distal interphalangeal joints. And the treatment is also different. In osteoarthritis, treatment is mainly based on lifestyle changes, exercises, joint protection, reduction in weight, and medications are mainly in the form of pain medications to reduce the pain. So these two conditions are entirely different with different symptoms, different joint involvements, different treatments, and different pathogenesis or different things which drive the disease itself. So they are very different diseases. I hope I have answered the question. Can we go to the next question, please? The next question is by Lisa. It is, will I be able to have a family if I have rheumatoid arthritis? It's a very important question, very important question. If you want me to answer in one line, yes, you can have a family if you have rheumatoid arthritis. The whole point in treating somebody with rheumatoid arthritis is allow them to lead a normal life, which includes having a family. Before attempting to have a family, there are few things which we should keep in mind. One is what is called as disease status or disease activity. If the disease is well controlled for at least 6 months before conception is planned, then it is much more comfortable to manage during the pregnancy. The second thing is medications. We have to be sure that whatever medications you are on are compatible with the pregnancy. If it is not, then there may be need to change them to other forms of medications which can be safely taken during pregnancy. Medications like hydroxychloroquine, sulfasalazine, azathioprine, these medications are also used to treat arthritis, rheumatoid arthritis, and these medications can be taken during pregnancy and during feeding or lactation also. So yes, people with rheumatoid arthritis can have a family, they can lead a normal life. Yes, absolutely yes. I hope I have answered the question. Thank you all for being part of this Healthcast. I hope we have been able to answer your questions properly. Due to time constraints, we won't be able to take further questions, but if you have any queries, please send them to us. We'll try to answer them offline. Thank you again.
thank you for being with us today. This was so much of a learning and so many tips to be joint smart. Stay tuned for more such sessions. Follow Manipal, follow Dr. Circle.